I thank my friend and colleague from Oklahoma because it's frustrating sometimes to have it continuously said that there are no alternatives being put forward when we have for years promoted major and comprehensive alternatives for the kinds of issues Americans are asking us to address today. And what is it that Americans are asking? I've said this many times on the floor. Americans are asking us to find a pathway to lower health care premiums and costs and to increase access to better quality health care. And yet, what is it that we are being faced with in this legislation? This bill drives up the cost of health care, not down, contrary to claims that have been made on the floor repeatedly, raises taxes by hundreds of billions of dollars, cuts Medicare by hundreds of billions of dollars, grows the government by $2.5 trillion, forces the needy uninsured, doesn't give them a pathway toward subsidized insurance or any access to insurance, instead forces them into a failing Medicaid program, imposes damaging unfunded mandates on the struggling states, leaves millions of Americans still uninsured, establishes massive government controls over our health care economy. And you wonder why we cannot get engaged in a meaningful bipartisan solution here with this kind of heavy-handed approach being insisted upon. When I talk about the fact that it raises the cost or the size of government, often the response is, no, this bill doesn't raise the size of government, doesn't increase the government. It's balanced. Actually, CBO has issued a report that says it reduces the deficit. Well, the fact is that it grows the size of government over a true 10-year period by $2.5 trillion. Now, it does provide some increased taxes, a lot, and it does cut Medicare, and so by doing so, it does reach an equilibrium, according to CBO, with regard to its impact on the deficit. But let's not mistake the deficit with the size of the government. This bill will grow the size of the government and the reach of the government by $2.5 trillion. Now, you've often, with regard to the question as to whether it truly impacts the deficit also, I think most Americans also have already heard that there's some budget gimmicks here. You could not ever claim that this bill doesn't increase the deficit unless you had all the taxes that I'm going to talk about in a minute, and unless you had all the Medicare cuts that we've been talking about for the last week, and unless you had the budget gimmicks that are in the bill. And what the budget gimmicks are clearly depicted right here. Just look at the first 4 years of this bill on the spending side. Very little, if any, spending. The actual implementation of the spending part of the bill doesn't happen until 2014. But all the taxes start in the first year. And all the Medicare cuts come into place in the first year. And we start seeing the offset side of the bill run for a full 10 years. Now, it's going to be easy to say that you've balanced out spending and taxing if you don't count the spending for the first 4 years. But if you look at that first true 10-year period of time, it's a growth of the government by $2.5 trillion. Now, Mr. President, what I'm here today to talk about is my motion that's on the floor to do one very simple thing, to commit this bill back to the Finance Committee and have the Finance Committee make the bill comply with the President's pledge to the American people about taxes. And what was his pledge? Repeated many, many times across this country. In the President's own words, I can make a firm pledge no family making less than $250,000 will see their taxes increase. Not your income taxes, not your payroll taxes, not your capital gains taxes, not any of your taxes. You will not see any of your taxes increase one single dime. That was the rhetoric. That was the pledge. What's the reality of the bill? In its first 10 years, the bill raises taxes by $495 billion. If you take that 10-year window that starts in 2014, where you're comparing spending and taxing at the same time, the total of taxes in that 10-year window is $1.2 trillion of new taxes, a huge proportion of which falls squarely on the backs of the middle class, whom President Obama has defined here to be those earning less than $250,000, and that's per family. He said under $200,000 per individual. Well, what are some of these taxes that we're talking about? First, there's the excise tax on high-cost premium plans. Now, one might say, wait a minute, that's a tax on companies, employers, who provide very high-quality insurance to their employees. It's an ingenious way. It is technically written that way, but it's an ingenious way to actually increase the cost, the tax base of the workers, not the employer. Let's see the first chart. The way this works is the government will now say to an employer, you cannot provide health insurance to your employees that is worth more than a certain amount. Most employees who get health insurance, and that's most employees in the country who get health insurance from their employer, get wages and health care as a part of their total employment package. And I just picked an example here of a woman who receives $50,000 in wages and let's assume a $10,000 employer-provided health care benefit. The government's now going to say, wait a minute, to her employer, we're going to tax you if you provide that employment benefit, that health care benefit on such a robust nature. CBO and joint tax have told us that the reaction of the vast majority of all employers is going to be to reduce the health care benefit down below the level that gets taxed. They are not going to reduce the employee's overall benefit, however, their overall employment package. And so let's just pick a number. Let's say they reduce this $10,000 down to $7,000. They'll increase the wages by $3,000, and the employee's total compensation package stays the same, $60,000. With one difference. Now that extra $3,000 is wages instead of health care, and it gets taxed. And that way, the individuals in this country see their health care values go down, their total compensation package stay the same, but then get also reduced as it's taxed. And our joint tax and CBO have told us that 84% of this $149 billion new tax is going to be borne by those with incomes under $200,000. That's one way that this bill ingeniously gets at the pocketbook of those making less money than the $200,000 or $250,000 as a family that the president talks about. What's the next way? Medical deductions. I think everybody in America who itemizes deductions knows about the line, first line, that says that you can itemize your medical expenses, and to the extent they exceed 7.5%, you can deduct those medical expenses. So people who have a large proportion of their income represented by medical costs get a break in the tax code for that deduction. Well, that break is now going to be smaller under this bill because the level of where you are able to get it is no longer going to be 7.5%, it'll be 10%. And as I indicated, that 84% of the excise tax is going to fall on people making less than $200,000 a year. 99% of the medical deduction restriction will fall on people making less than $200,000 a year. As a matter of fact, making a lot less than $200,000 per year. And then what about the next one? The next major tax in the bill is the Medicare payroll tax. Now this one has been presented to the American public as a tax on rich people. And it starts out primarily impacting people at the higher levels. But at the outset, it will already hit 345,000 Americans. And it's not adjusted. I think most people understand how the alternative minimum tax works today. It's not adjusted for inflation properly. And so over time, the payroll tax itself is going to increasingly hit more and more people in that income category under $200,000. There's been some analysis on just these three provisions in the bill. Joint tax has indicated that by the year 2019, at least, and I say at least because we're only talking about three provisions in this bill right now, and there are more. 73 million American households, not individuals, households. 73 million American households earning below $200,000 are going to face a tax increase. Now, some have responded to this by saying, wait a minute, our bill actually cuts taxes, and you're not characterizing this fairly. The tax cuts that they are talking about are primarily a $394 billion government subsidy for purchase of health insurance, a subsidy that will be administered through the tax code. What they don't tell you is that 288,000 of this so-called tax cut is nothing other than a direct government payment to those who don't pay any taxes today anyway. It's not reducing their tax liability. They have no tax liability. It's a direct government subsidy, and CBO says so. It is scored by CBO not as tax relief. It is scored by CBO as direct government spending. And to characterize that as tax relief, I believe, is inaccurate. Moreover, even if it was true tax relief, is that what the president was saying? That I won't raise your taxes more than I will lower someone else's? Or was he saying to the American people that he would not raise taxes on people who are making less than $200,000 a year or $250,000 as a family? I believe it's inherently obvious what the president was saying. And to say now that we are cutting somebody else's taxes so that we can raise yours does not comply with the president's pledge. And just to give you another couple of perspectives on this in terms of numbers, when all is said and done, 7% of Americans will get this so-called tax relief that is in reality direct federal spending. And the rest of Americans, specifically those who don't fall in that category, will get the tax increases. Out of 282 million Americans with some kind of health insurance today, only 19 million of them will be helped by this subsidy. The rest are going to fall into that category of those who get to share in the burden by seeing their taxes increase. Well, but let's say we give credit for all of these arguments and say, all right, we will let you claim that all of this spending is really tax relief. What's the true story then? Even if you give that argument, which is not valid, by 2019 there will still be at least 42 million American households earning below $200,000 who will face a tax increase. And this is information from the Joint Committee on Taxation. And in fact, the data there is rather interesting. Joint tax data indicates that by 2019, individuals earning between $50,000 and $200,000 on average will see an increase in their taxes of $593. Families earning between $75,000 and $200,000 would see on average a net tax increase of $670. So what does my amendment do? My amendment says, very simply, that the bill will be committed back to the Finance Committee and that the provisions in the bill that violate the president's pledge should be removed. Simply make the bill comply with the president's pledge. The president, frankly, shouldn't sign this bill unless this amendment is passed and implemented, because that's the direction that we need to go. Once again, the president's pledge is that no family making less than $250,000 is going to see their taxes increased. Mr. President, there's further information available about this, though. I recently sent a letter to the Congressional Budget Office, was it to the Joint Tax or the CBO? To Joint Tax. I recently sent a letter to Joint Tax asking them about whether there were other provisions in the bill other than these three. The reason I talked about these three taxes is because those three taxes have been analyzed by Joint Tax, and it's Joint Tax that is telling us what they are going to do. In response to my letter saying, are there more taxes in the bill than just those you've analyzed, the answer has come back, yes. And below, they say, is a list of the provisions that they have not previously distributed and that have statutory incidence on individuals with those who fall become the income threshold, which has been defined already. What are these taxes? There's a confirmed definition of medical expenses for health savings accounts. In other words, the reduction of benefits in health savings accounts will have an impact. And I believe that impact is about $1.5 billion. The increased penalty for non-qualified health savings account distributions. Limitations on flexible spending arrangements, which will raise almost $15 billion. And most of this, although we haven't got the data yet from joint tax, most of this coming from families below the income tax thresholds, as well as the 5% excise tax on cosmetic surgery and similar procedures, and the individual mandate in the bill that will force all Americans to purchase insurance, or the IRS will come and collect a fee from them. I don't have the chart with me here that shows what's going to happen with the IRS, but if you can just think in your mind for a minute, the current size of the IRS is about $12 billion in terms of the appropriations that we give to the IRS to perform its functions. The CBO says that if this bill passes, there is so much additional business for the IRS in monitoring health care and the new plans and programs in this bill that there's going to have to be at least another $5 and maybe $10 billion increase in the size of the IRS, just so that it can implement its enforcement responsibilities under this bill. Mr. President, the bottom line here is that the President of the United States, Barack Obama, has made a pledge. It was that pledge, among a number of others, like if you like what you have, you can keep it, that has caused us to see a strong confidence level by the American people that maybe it's time for Congress to truly dig in and build a strong health care reform package. And yet that pledge is being squarely broken by this bill. Again, Mr. President, all we are asking in this bill, in this amendment, is to send the bill back to the Finance Committee and have the Finance Committee make the bill conform to the President's pledge. And what that will mean to the American people is that in the first 10 years of this bill, just under $500 billion of new taxes will not be imposed. And over the true first 10-year period, when the spending starts kicking in, $1.2 trillion worth of taxes will not be imposed. Mr. President, there are many other issues with this bill that we have seen discussed. There's the question of whether it truly does increase the cost of premiums in health care or not. Virtually 10 out of 11 studies say that it does, and the CBO report says that clearly for 30% of Americans it does in major ways, and for the other 60% the impact is marginal or pretty much status quo. Mr. President, as we move forward, some of these big problems with the bill need to be fixed. My amendment, my motion, focuses on taxes. We've debated Medicare for some time now. We need to talk about the unfunded mandates on the states. We need to talk about the impact on premiums and health care, because we definitely don't want to be passing legislation that drives up the cost of health care at a time when that's the primary purpose that people are calling for health care reform. And so I would urge my colleagues to let us just step down for a moment from the intensity of the debate, recommit this bill, or commit this bill to the Finance Committee, and let us on a bipartisan basis work out some of the solutions to these problems, and do so in a way that does not result in such a massive growth of our federal government, such a massive increase in taxes, such a massive unfunded deficit on the states, and all for no control of costs or health care premiums. With that, Mr. President, I yield back the balance of the time that I've requested.